presentation is a newborn screen parent perspective. I think you'll find this one really interesting. This lady is going to talk to us about what it's like to navigate care for ALD as a military family. Would you please welcome Lauren Wilson from Virginia?
All right, can everyone hear me? All right, awesome. Good afternoon. I want to thank Elisa and Miranda for inviting me to speak today. Super nervous. I'm sorry if I talk really fast. I just want to say I find it fitting that I was asked to speak today, as today marks exactly 1 year since Virginia, which is my home state, added ALD to their newborn screening. My name is Lauren Wilson. I'm a preschool teacher, a proud Navy wife, and most importantly, the mom of 2 wonderful kids. I was born and raised in the Hampton Roads area of Virginia and left to pursue a teaching degree from Longwood University. I met my husband just 2 years into my teaching career and followed him to upstate New York, where we began our happily ever after. We married in 2011 and began trying to grow our family about 1 year later. Our daughter Mallory was born on Christmas Day in Virginia in 2013. About a year later, my husband made the rank of chief, and it was time for our family's next adventure. After being promised we were staying in Virginia, we got orders to Groton, Connecticut. After all, that is the Navy way. To say I was devastated is an understatement. I'd really had my heart set on staying near my family, but the Navy had other plans. We moved to Connecticut by the end of 2015. In September of 2016, I was pregnant again, and just before Christmas, we found out that we were having a boy. My pregnancy was fairly uneventful, and we prepared our home for our second child. Nash was born June 4th, 2017. He was a big boy at 8 pounds and 11 ounces, and he was perfect. Our family was over the moon, and my little family was complete. All right. Nash had his first doctor's visit a few days after we left the hospital. What was a joyous time quickly turned to dread. Our pediatrician, who I loved, was extremely awkward and standoffish. I couldn't put my finger on what was going on until she dropped the bomb on me that Nash's newborn screening came back concerning for a disease called X-linked adrenal leukodystrophy, and we need additional testing. She handed me a printout and quickly left the room. I was shocked. I had no idea what she had even just told me, and she gave me nothing more than a printout. As I waited for the nurse to come back with my referral, I started to read what the doctor had given me. I read enough to know that my son had a disease without a cure and would die within 2 years of showing symptoms. I held it together long enough to get my referral and go to the car. I sat in that parking lot and cried for what felt like forever. My husband got home that evening, and I cried again, sharing with him the printout and what I'd read and the little I'd been told. I made his appointment soon thereafter and waited what felt like a lifetime to meet with the geneticist at Yale. In the time between these appointments, I prayed the results were wrong. How could my seemingly perfect child be dying? About 2 weeks passed, and we met with genetics, where they collected labs to be sent to Baylor for additional testing. On July 20th, 2017, we had the results, and my worst nightmare was confirmed. My son had ALD. I was devastated all over again. We discussed the need to see neurology and endocrinology, as well as to establish a relationship with the transplant team. At this point, I was also tested for the disease. A few weeks passed, and I got another gut punch. I was the carrier. I'd given this awful disease not only to my son, but potentially to my daughter. The guilt set in. I spent my nights crying over what I felt I'd done to my family, crying for the guilt of it all, crying over what my future with my family would look like. I never thought I'd be a special needs mom, and the thought was frankly overwhelming. The specialists at Yale helped ease my concerns. They listened to my fears and told me how they'd care for our son and how newborn screening would potentially save his life. I went home and started looking into ALD and found groups on social media that I immediately joined and found so many children living with ALD, not all dying from it. In my research, I also learned that Virginia, the state I'd wanted to stay in so badly, wasn't screening newborns for this rare disease. I started checking the list of places we'd be likely to be stationed, and very few were testing for ALD. How? How could this be something states weren't testing for? For less than the cost of a cup of coffee, that could save a child's life. Didn't that matter? Wasn't that important? I quickly realized that I wanted to be involved in this community. So many of my heroes are in this room. Young boys fighting ALD, parents of ALD children, adults living with ALD, and the medical teams and advocates working tirelessly to help save my baby and so many other babies. I wanted to ensure my son had the best possible chance at life. Outliving your child is a parent's worst nightmare, and I wanted to be sure that wasn't our fate and wasn't the fate of any child born after mine. As a military family, we are also in a unique position as we move about every 2 to 3 years. My son's life, the life of these children, should not be dependent solely on their zip code. My child's life is not more or less important based on the state we are stationed in. Since Nash's birth, we've lived in West Tennessee before they began newborn screening for ALD. And now we are back in Virginia, and we came back before they started newborn screening for ALD. As if his condition and moving weren't stressful enough, we get the added stress of starting over with a new healthcare team. In addition to the routine healthcare for me and our children, finding new primary care physicians, dentists, and the like, Nash also has to reestablish care, specialty care, with each move. This means that he's seen 3 neurologists, 3 endocrinologists, and 3 geneticists in just shy of 6 years of life. This means new referrals to even get on lists to see these doctors. It means 3 different children's hospitals we have learned to navigate. As his mother, my role has morphed into being an advocate for his care. I take on the responsibility of educating pediatricians who are not familiar with ALD. I take on the task of advocating for specialist appointments. I follow up with the staff on the orders that may have slipped through the cracks. I research who in the area is the most equipped to care for my child, and then fight for him to see those specialists when they're not covered by our insurance. Should Nash ever become symptomatic, these struggles will only increase. Everywhere we've lived since his birth, Nash has been one of the youngest asymptomatic ALD patients doctors have seen. While it's inspiring, it's also heartbreaking. I think of how many children have been born and are living with this disease without knowing. How many children are suffering from symptoms without a clear diagnosis or understanding of what this is? I've had to educate providers on care for my son, leaving me concerned with the care that he has received. I've spent the last 5 years educating teachers and caregivers on Nash's condition and the changes to be on the lookout for. The reality of being a rare disease family is that not everyone is knowledgeable about this disease, and not everywhere is capable of caring for this disease. Our family cannot be stationed outside of the continental United States. It also means that we are severely limited in where we can move within the U.S. because we have to be close to a medical center that can handle his care. Because we are rare, the funding for research simply does not exist in the way it does for diseases like cancer or diabetes, so the options are often slim. There is great work being done, but in the meantime, my focus must be on advocating for the best care for my child, no matter where we are. Nash is now almost 6 years old. He's preparing to finish kindergarten just 2 weeks after his birthday. He's smart. He's so funny. He's got the biggest heart and is quick to tell those he loves exactly how much he cares about them. He gives the best hugs, and he's the best snuggler. He's a typical ornery little boy. We call him Crash Nash, as he's a bull in a china shop in all that he does. Some days I forget he has this awful disease. But the disease is more than just MRIs every 6 months. It's blood work, it's neurology and endocrinology appointments. It's waiting for those results and breathing a sigh of relief when you get those 2 coveted words, all clear. And then it's starting the process all over again. His care, even in health, is a lifelong commitment. There shouldn't be an option for states to choose if they'll screen for these rare diseases or not. It is their duty, their obligation to their people to protect the children born in their state. And in my family, we take duty seriously. As my husband serves our country and has vowed to protect this great nation, our children deserve the same: safety, security, defense, protection through newborn screening. Thank you.
Thank you, Lauren, for having the courage to share your story. I've seen a lot of presentations from newborn screen moms, and sharing that can be a really raw experience, so thank you. It was a privilege to hear that.